Well, this year, more than 106,000 women in the United States will be diagnosed with gynecological cancer. They are treatable, but those treatments are more effective when they are found at an early stage. This month is Gynecological Cancer Awareness Month, and joining me now is Dr. Kate Dugan with Rocky Mountain Gynecologic Oncology. Thank you so much for joining us. And it's a big month, and we were just saying it's kind of a scary thing to think about, but it's something that we need to talk about. So how common are these cancers?
So there's a variety of cancers that are part of gynecologic oncology. So ovarian cancer, which September is Ovarian Cancer Awareness Month. And the risk of getting that is about 1 in 78 women.
Okay.
So not super common. Uterine cancer is a little bit more common. We have about a 3% lifetime risk of that. And then cervical cancer is a little bit less common.
All right. And what are some of the symptoms? And I know that you just talked about 3 very different cancers there, but are there things we should, be in tune with for our body to look out for?
Absolutely. So for cervical cancer and uterine cancer, the most common first sign is bleeding. Bleeding that's abnormal, either bleeding after menopause or between periods if you haven't gone through menopause yet.
Okay.
And then for ovarian cancer, it's a little bit tricky because it's sort of vague, but the most common signs are bloating, feeling like you can't eat as much, like getting full after a really small meal, or feeling a lot of pressure in the pelvis.
Okay, so if you feel signs like this, and are there anything else that we should look out for, to pay attention to?
Always looking out for unexplained weight loss. That's never sort of a normal thing, so that would certainly be a red flag as well.
Okay, so if something were to happen and maybe you got some unfortunate news, what do some of these treatments consist of, and how advanced have some of these gotten as well?
So things are advancing every year, which I'm sure you're used to hearing. So for ovarian cancer, the upfront treatment consists of a combination of surgery and chemotherapy. And we now have more and more treatments to try to keep people in remission once we get them there with ovarian cancer. And then for endometrial cancer, we're often able to cure the cancer just with surgery alone.
Oh, wow.
But sometimes do need to use some radiation as well, or chemotherapy depending on the stage. And then cervical cancer is generally treated with radiation. So we're definitely making progress. We have a long way to go, but things are getting better.
That's great. I mean, those are scary things to hear if you get diagnosed with something like that. So to hear some news like that it is getting better and treatment is probably it's sometimes a little bit easier, is something that maybe is good to hear.
We've definitely gotten better at managing the side effects of treatment, so a lot of women are able to go through their treatment and not have a lot of side effects and do well with it. So
that's
been a good advancement.
Thank you. And thank you so much for coming in today. This is such important information. We know a lot of our viewers right now are women, so we really appreciate all of the information. And you can watch this full interview if you want to share it with a friend. It will be on CBSColorado.com.